In this video, we will learn some facts about Parkinson disease and what is Parkinson disease. So let us start with the symptom. The persons that have Parkinson disease are usually the elder age person. And what are the symptoms of this Parkinson disease? Is the slow movement, tremors means continuously shaking of a certain part of the body, speech changes, they are not able to speak properly, loss of smell, flatulence. And the main reason for this is that Parkinson disease is a neurodegenerative disease. The neuron stops for functioning normally, as it is shown in this figure. Is that how the normal neuron works? Normal neuron works is that it gives a signal that is taken by dopamine and it will bind to the receptor, and this binding of dopamine to the receptor will trigger signals such as the normal movement. Yeah. And this is connected with the reactive oxygen species that get activated when the dopamine binds to the receptor of the other part of the neuron. And in the uh, brain figures, it is shown that dopamine is present here, and it is essential for motor skills, that is for the movement skills. And what happens in the Parkinson affected neuron is that the dopamines are not enough. With time, with age, the amount of dopamine decreases. Because of this, they will not be able to bind to the receptors, so it will not give enough signals for the movement, normal movement, we can say. So that leads to the movement disorder such as tremor, slow movement, rigidity. And uh, there are different kind of treatments available for Parkinson disease. The conventional approach is to use a dopamine agonist. So what is this dopamine agonist? Dopamine agonist is uh, works in a similar way when when the dopamine binds to the receptor. For example, the dopamine binds to the receptor, it gives a specific type of signal, that is activate reactive oxygen species that leads to normal movement. So this dopamine agonist works the similar way as the dopamine do. The dopamine agonist binds the receptor of the neuron that gives uh, the reactive oxygen species within that neuron, and that leads to the normal movement. However, the problem with this dopamine agonist is that it has a lot of side effects and it affects the health of the patient. Uh, in other It affects the health of the patient, and in other kind of diseases uh, while treating this Parkinson disease. So there is a another approach that has been recently developed, that is functional uh, medicine or integrative approach, that is use of glutathione. So what this glutathione uh, work is known for it is known for degrading the toxic material that is present within the cells, and it has been found that the people that have Parkinson disease have low amount of glutathione. So because of this, the toxic chemicals that are present in the brain are exist for a longer duration of time, and that might contribute to the Parkinson disease. However, the exact relationship is not yet, or it is not yet been correlated. However, people have used glutathione to the Parkinson disease, and they have found that the intensity of Parkinson disease decreases to the patients that are treated with glutathione. And this glutathione has been found to be effective against the other neurodegenerative disease. So this makes a positive case for using glutathione for treating Parkinson disease, as it will reduce the toxic substance that are present within the brains of the patients that are affected by Parkinson disease. So that's all for this video. Hope you will get an overview what the Parkinson disease is and what are its symptoms and what are the approaches, conventional and integrative approaches are being used to treat the Parkinson disease. That's all for this video. Thank you for your time.